We were talking about resistance training. Resistance training to improve our muscle as we age, to prevent age-related sarcopenia or muscle loss. So we saw upper body strength exercises or resistance exercises in another video. So in this video, I want to show you about a simple exercise that does not cost you a penny. Absolutely zero expense, that you can do at home. You don't even need any equipment. All you need is a healthy mind and a decently healthy body. So this one exercise is called deep squat. It involves the lower extremities from waist down. So this exercise, deep squat, is highly ignored in many exercise regimes, any exercise routines. But I want to bring this back to your attention. This is done when we were growing up as kids. This was part of a religious exercise for us, where we do deep squats and we would count how many can do the maximum deep squats as a kid. But I want to bring this back to your attention. One word of caution is, if you have any back problems, if you have any bulging discs, back surgeries, sacroiliac problems, sacroiliitis, any such problems, be careful with this. You may want to start it really slow and test it out how you're doing. I don't want you to get injured by doing this. So the way it works is, let me show you how it works and what muscle groups are involved in this and what are the benefits of this. So if you can do this at least few times a week, each cycle you want to do at least 5 or 10, but be careful, you test it out and see how it works for you. The more you do, the better. So now this is how it works. Hold your hands up like that on your shoulders. Let me see if I can show you going back a little bit here. Hold your arms up like that and go straight down. See, this is different from the squats where you do weight exercises, where you actually hold a bar with weights and you go down like that, and you see how you bend forward with that, and you actually push against resistance and go up like that. So this is that weights squat exercise, but this is different. This deep squat is what they call Asian squat, where Asians do mostly, because when they every morning when they go for a bowel movement, most Asians in the past at least would sit like that, and because of the pressure on the abdomen and the pelvis, you would have an easy bowel movement. So this is how it works. But we're not doing that anymore because we have Western toilets these days everywhere. So we lost that art of deep squat. Now we want to bring that into our lifestyle by actually forcing it into our exercise routine. So you hold it this way. In India, we used to hold our earlobes and go down like that, but now you can do that. Actually, it's kind of fun to do it that way, or you can hold it this way. So you hold your shoulders, both shoulders, crisscross your hands, hold your shoulders, go straight down, not forward. You want to go straight down, as far down as possible. You see if you're able to touch your butt to your ankle. It's not easy, as you may imagine, but because these muscles are tight, because we're not used to doing it, these muscles become so tight and your back may hurt. So when you're doing it, you have few muscle. Always when you think of resistance training, think of muscle groups. The muscle groups involved in this type of exercise: glutes, hamstrings, quadriceps, and calf muscles. So you can see that muscles getting stretched and contracted as you're doing it. So you go down, go all the way down. You have your feet, a pelvis, a waist apart. And you don't want to do this. You really can't go. So you also don't want to do this. You want to do a little, just a waist apart, your feet a waist apart, and then go down like that and see if you can touch and then straight back up. See how many you can do. You know, you might want to stop at 4 or 5 or even 1 if you can do it. Some people can go that far. It's totally fine. You may want to start really slow. Go down like that. Slowly you will make your way down to the floor and go all the way up. So in doing that, you are actually pushing your abdomen against resistance, and you are pushing your legs against resistance. Your gravity and your body weight is your resistance. Now again, as you go down, you try to touch as down as possible. If you cannot touch, that's totally fine. Eventually you will. If you have difficulty going past this, it's just because your muscles are tight. Don't worry about that. Eventually you will get down, you will get there. So the goal is to improve, not perfection. So going down, you touch as far down as possible with your butt, straight back up and straight. From the side, it's going to look like this. Up. And if you want to hold your earlobes, that's totally fun and funny and cool. So you go up like that and see if you can test yourself, challenge yourself. I bet you after about 15 or 20 of these, your heart rate will go up by at least 30%. You'll start sweating, you'll be hyperventilating. That's because of the deconditioning. So eventually your body gets used to it. The best part of this is it works both as a cardio exercise and also resistance training. Resistance training is because you're pushing against resistance. Cardio because you are actually increasing your cardiac output. When you go down, your venous return, what we call venous return, increases. So your heart will get a lot of return blood supply. So imagine you go down like that. See, this calf muscle is what we call peripheral heart. Peripheral heart. So by compressing this, you're actually pushing a lot of venous return back to the heart. So heart has to work harder to push it out. So by repetitive squats, you're actually making your heart work harder, and that is also called aerobic exercise or cardio exercise. So it works as both cardio and resistance training because you are pushing against the gravity, and your body weight acts as the resistance along with gravity. The muscles involved are glutes, quads, and this back muscles here, and you have this calf muscle. So I hope you get something out of it. Try to incorporate this into your daily or weekly exercise regime, routine, and see how, I want to challenge you to see how many you can do now and how many you can do a month later if you follow a routine, a daily or a weekly routine. So again, a word of caution is do not be too heroic when you're doing starting it off, because you can hurt yourself. Start slow, like any exercise routine. Start slow, do a few, in fact just do one and see how it feels. And if it's too tight, don't give up. If you only can go that low, it's totally fine. Eventually you'll get there. So keep working on it. Along with the upper body exercises we talked about last time, incorporate this. In the next few videos, we'll continue to work on muscle groups with resistance training. And remember, why resistance training? Especially as we age, we develop what's called age-related sarcopenia or muscle loss. That's part of aging. And muscle is very important to prevent insulin resistance, chronic inflammation, and other chronic diseases. So to mitigate that, to prevent that from happening, incorporate these. Get away from the sedentary life, especially those people who are working from home. exercise becomes very important, especially these software engineers, and even HR people, human resource, and some of these jobs which are working from home incorporate exercise regimen. If you look at my home exercise equipment, it's quite simple. Let me show you what I have. This is the stationary bike that I use for my routine, and this is the elliptical, and this is the stationary bench that I have for exercise. So that's pretty simple. I don't have a whole lot of investment into it, but this is good enough for me. And I develop sacroiliac pain if I exercise too much, so I have to be careful. Everybody has their own weak points, so you have to listen to your body when you're doing these exercises. See what works for you, but try this deep squat or Asian squat. I'm sure you'll benefit from it. Till we meet next time, stay safe and stay healthy, friends.